In recent years, the polyvagal theory, first proposed by Dr. Stephen Porges, has garnered significant attention in the understanding of chronic anxiety. A 2020 study, published in the journal Frontiers in Psychology, provides compelling evidence supporting the theory's application in clinical settings, particularly in treating anxiety disorders. This study elucidates how the vagus nerve mediates autonomic state regulation, affecting both emotional and physiological responses, such as heart rate variability and respiratory sinus arrhythmia. As wellness practitioners, understanding these mechanisms allows us to better address the root causes of anxiety, rather than just managing symptoms. The vagus nerve serves as a critical component of the parasympathetic nervous system, responsible for rest and digest activities. Polyvagal theory posits that this nerve influences our ability to regulate emotional states. Thayer and Lane in 2009, in Biological Psychology, highlight how vagal tone, an index of parasympathetic nervous system activity, correlates with anxiety levels. High vagal tone indicates better emotion regulation capabilities, often resulting in reduced anxiety symptoms. Clinically, interventions such as deep diaphragmatic breathing and cold water face immersion can increase vagal tone, offering non-pharmacological options for patients suffering from anxiety. Polyvagal theory delineates three primary neural circuits: the ventral vagal complex, the sympathetic nervous system, and the dorsal vagal complex. These circuits determine our physiological state in response to environmental cues. As outlined by Porges in 1995 in Psychophysiology, the ventral vagal complex promotes social engagement and calm states, contrasting with the sympathetic activation of fight-or-flight responses and the dorsal vagal complex's role in immobilization or shutdown. Understanding these circuits helps practitioners tailor interventions, like social engagement exercises or physiologically informed therapy, to move clients towards a ventral vagal state, essential for reducing chronic anxiety. Research by Beauchesne et al., 2007, in Development and Psychopathology, indicates that disruptions in autonomic balance, as conceptualized by polyvagal theory, can contribute to anxiety. Specifically, dysregulated responses often result from an overactive sympathetic system or a dominant dorsal vagal response. These findings suggest that interventions aiming to restore autonomic balance, such as biofeedback or HRV training, can be effective. Clinicians might employ protocols involving 5-minute daily HRV training sessions, which have shown to enhance autonomic regulation and reduce anxiety symptoms. Incorporating polyvagal insights into clinical practice involves a nuanced understanding of autonomic states and their triggers. As demonstrated by Ogden and Minton in 2000 in Traumatology, somatic therapies that integrate body awareness can effectively shift patients towards parasympathetic dominance. Techniques such as somatic experiencing and sensoromotor psychotherapy allow patients to safely explore and modulate their physiological states, facilitating a reduction in anxiety. Practitioners can guide clients through individualized sessions focusing on body awareness and controlled breathing, promoting autonomic flexibility and resilience. Despite its widespread application, polyvagal theory has faced critiques, particularly regarding its empirical validation. A critical review by Grossman and Taylor, published in Psychological Science in 2007, points out the challenges in consistently measuring vagal tone and differentiating it from other autonomic processes. Furthermore, while the theory provides a compelling framework, its application can vary across individual differences and specific anxiety disorders. Therefore, practitioners should integrate polyvagal principles with other evidence-based interventions, ensuring a comprehensive approach to treatment. Clinicians aiming to utilize polyvagal-informed interventions should focus on enhancing vagal tone through practical evidence-based methods. Protocols may include daily diaphragmatic breathing exercises, structured social engagement activities, and regular HRV biofeedback training. As research grows, continued professional development in polyvagal-informed practices can expand therapeutic efficacy. Ultimately, integrating these strategies within a holistic treatment plan may empower clients to achieve better autonomic regulation and reduced anxiety.